Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Shirish Sachdeva and Ziya Altug. Both of them are physical therapists. The Kevin MD article is Why Your Clinic Waiting Room May Affect Patient Outcomes. Everybody, welcome back to the show.
Thank you, Kevin. Thank you for having us.
Thank you. Thank you for having us.
All right. Shirish, why don't we start with you? Just summarize this latest article that both of you wrote for those who didn't get a chance to read it.
Well, Kevin, thank you for having us publish this second article with you. I enjoyed writing it, as well as I hope that your audience likes reading it. The article basically stems from the thought that the first impression that comes in any clinic or hospital comes from a waiting room. People enter in the waiting room anxious. So that's kind of the thought that this article kind of stemmed. And obviously, we went on a search spree on finding research articles to see if there's any science behind it. And lo and behold, we found a lot of articles, scientific material that dated all the way back to the times of World War, actually. And then even till now, we have these recent articles that still come up. So we see this as a current problem. And yes, we talked about different inputs that can affect, like, music, arts, different cultural inputs that can impact people's time when they spend in a waiting room. So it's all measurable stuff that we have, and it is well backed up by science. And I think it is well worth the read to get an idea about it as we delve deeper into it.
All right, so Sharish, for those who didn't get a chance to read the article, just give us a high-level overview. What are the various elements in the waiting room experience that may affect patient outcomes? Typically in waiting rooms, I always see a typical TV turn on to a local news network, but a lot more goes into that. So, Sharish, just give us a summary of the various elements we're talking about.
I think that is a really fine analysis of it, because one thing that we see is news channels running on it. And I think I'm highly on the point of this, that news channels should be really not in a waiting room area. They feed into the anxiety that people already step into. I mean, we know these waiting rooms are buzzing with lights, cramped up chairs, people running across places. And even if you look at, not even obviously, you look at an emergency department, it's crazy. But then when you look at outpatient clinics as well, people are heavily busy into it. So I think the bigger picture synopsis is that we want our waiting rooms to be as calm, as welcoming, as eased out spaces for people to rest, understand where they're coming from, where what they're going to get as far as the experience is going to be when they are in the clinic or in a hospital for next couple hours. And that healing process, to a certain degree, even starts even before the first physical touch has been done by a physician or a nurse practitioner to the patient. So I think that's where this is an important element to kind of bring into. And the psychology of waiting is really, really stressful. I mean, when people are there, they're anxious about their medical problems for sure. The physical and psychological element that kind of intertwines throughout this process, it speaks volumes when people come in with physical injuries, but they don't know if they're going to get better today, or is it going to be a long journey for next 8 months or a year. All that process will get addressed step by step, but in due course when that time passes. But also in that waiting room space, the foundation starts getting laid to a little bit. So when we saw these different studies, right? We looked at studies that talked about the impact of music. We looked at studies that talked impact about colors, so even like colors of your walls, how it impacts. Where one of the studies that was on music, that was a systemic review, where basically, we're trying to review, for anyone who doesn't know systemic reviews, we're asking a question, a scientifically developed question, but we look at all these different studies and try to see where that answer comes from out of these, if all of these different researchers try to look at it. And one of the studies on music talked about reducing anxiety, and this was
Mhm.
published in the Journal of Anesthesia, like in 2014. So it's not recent. So, but it showed that 14 studies out of those that were reviewed they explicitly stated that just before a medical procedure was done, if people listened to lower calmed music, their outcome of the procedure in terms of pain perception, in terms of even the quality of the treatment that was received, was way higher than those who just received a standard amount of care. While in another study, similarly on music, which was published in Journal of Pain Management in Nursing 2022. Now, this was a little bit more recent, where they looked at like 200 patients. And this was interesting because what they did was they looked at two separate clinics. One
Mhm.
was a clinic where they played the regular music on a speaker phone, and then the other one they had a live music practitioner, a student of music, who actually played like flute and sang a little bit, played keyboards in a calm and low volume environment. What they saw that both these clinics, they flourished with the numbers of stress and anxiety way lower than the standard clinic that would have.
Mhm.
And then what they also saw was between these two clinics, it was interesting to notice that the clinic that had that live musician playing, the additional lowering of agitation, pain perception, and even nervousness levels, they were all reduced.
And may I
So,
add a couple thoughts to that, if that's okay?
Mhm.
yeah.
Yeah, so if you're going to create a pleasant waiting room, you can have a television, but maybe have that television on a nature show. A few plants go a long way. Scenic pictures that draw people in, pleasant music, something that's contemporary and pleasant. You can have puzzles, something as a distraction technique. You can have labyrinths where people use their finger to make little labyrinth type of movements, puzzles, making sure the room is ventilated, well ventilated, also kind of having the chairs spaced apart to give people a little bit more breathing room and so forth. So those are some practical tips.
So, Zia, how much thought typically goes into the design
Mm.
of a waiting room in a traditional medical practice? Because it sounds like that the relationship that that patient has with their clinician even starts before they meet them. It starts in the waiting room. So, Zia, in your experience, do medical practices put a lot of thought into some of the design choices that you guys are mentioning in the waiting room?
I think it depends on a clinic by clinic basis. Some of the clinics that I go to at large hospitals or private clinics, you can see that there is effort put in. They have a fish tank in the waiting area, nice music, soothing, and so forth. Other clinics are just chairs and walls and basically the rest of the facility is great, but obviously they didn't want to put too much effort and time and take up too much space from the treatment area. So I just think it depends on a clinic by clinic basis. And I know more European clinics are putting an emphasis on clinics or the waiting areas in clinics. And it is making a difference based on the studies that we've seen. And I just think that patient care begins in the waiting room. If a person can come in to see the doctor, the nurse, the therapist a little bit more relaxed, I think that goes a lot further in helping the patient get better.
And Zia, in terms of some of the data that you have researched along with Shirish, these systemic reviews, what type of outcome measures are we talking about? I heard things like decrease anxiety, and how about in terms of the patient experience? Has there been any data showing that it improves patient experience scores, patient outcomes, just from design choices in the waiting room?
From my point of view, I can say that it has what we've seen is that it does have a reduction in stress and anxiety and helps elevate the mood. But I will defer to Shirish to see if he has any other thoughts that come to mind.
So most of these studies had utilized self-reported questionnaires pre and post any kind of intervention. So those surveys were the ones that were coming out with percentages of improvement or scores. And yes, they did show, because again, the comparison was similar questionnaires being given to people who were in standard clinics. So those scores did vary, and surely we saw different improvements. But on the other hand, there were some studies like one, because we just touched on the point of talking about having labyrinths or having some kind of activities in there, where there was one study that was a pediatric clinic design, and it was more of an analysis-based study by the organizations themselves reviewing their hospitals. So this was in Shenzhen, China, if I'm not wrong, and this was in 2021, so still recent. And they reviewed like three hospital setups. And all they did was, this was a more qualitative analysis
Hmm.
of these places. And ultimately, they found out that the patients in these hospitals with their experiences would prefer having a better mother and infant room in the hospital. They would like a children's play area to begin with, where children can wait, because we know how nerve-wracking it can be for a child to be in such a stimulative environment like a hospital. And so even drinking water to be easily available. And as Z touched on it, where having those indoor plants
Hmm.
or scenic view from the windows. So these were more qualitative points that they came down with in this recent study. But this was more of a qualitative study. While there's another analysis that I think it was done, and this is more towards kind of going towards how we can help with nowadays technology, you know, in the waiting areas. And this was particularly voiced towards emergency departments, because that being kind of the at the forefront of the anxiety spaces. So what they noticed was that about 63% of about 340 patients who were interviewed responded to having some sort of technological input or new technology introduced in there that could have helped in reducing the anxiety. And most of them lean towards time trackers in
Hmm.
emergencies. So if we know that how, when you're driving by a highway, you'll notice that some emergency departments have actually put up how much waiting time there is in their hospital. Similarly, what they said was that if we could have individualized time trackers for patients. So if somebody, checks in an emergency department and they say, okay, please wait in line, or, go back to the waiting area and we'll call you in. So if on their phone or somewhere on a screen in an emergency department, they see a little tracker saying, okay, your number is 265 and you have 5 minutes waiting time.
Hmm.
So something like that shows up. It also showed decreased anxiety levels, and then thereby improving patient outcomes of the whole experience. It is, I think, when you, Kevin, talked about the experience part of it, what I think is that the the fact where patients, reply in the end or give a review at the end saying, when I went to this clinic, I loved my doctor, and then, but this extra, the outside
Hmm.
environment was not congenial, or I had this and this extra thing. So I would give full points to my physician or my practitioner, but I would not be, wanting to go back to that space. That is such a detrimental input to just a brilliantly performed examination by a physician or someone. It's just something that we can so easily pay mind to and
Hmm.
improve, and has a major impact. So I was when I was researching this whole article, I felt like hospitality is not just in the hospitality sector.
Yeah.
It forms in all sectors, and primarily when we are dealing with people in their lowest form of their shape, of their health, they need the best hospitality that we can provide them, and that starts right from the beginning.
And it's not just the waiting area, it's also the clinician's room, the doctor's office for the examination. That could have small touches of plants and pictures on the wall and maybe a lampshade or something to make it look more home or living room like, to kind of ease the patient's anxiety and stress, even in the exam room. So
Hmm.
those small things could also be helpful.
And when it comes to these patient experience scores, it's not just the physician, as both of you are saying, it's everything around the physician. It could be the parking and, of course, the waiting room, and so many other factors go into that patient experience outside of that one-on-one encounter with the physician.
Yes.
So, Zia,
Yes.
in your article or in the article, both of you mentioned cultural sensitivity when selecting decor or music, especially for a diverse clinic. So, Zia talked more about the choices that we have to make and be sensitive to the spectrum of cultures that visit our clinics every day.
I think music is probably a little bit harder to pinpoint for cultural differences because if you're in a large city, you're going to have many different cultures coming into that clinic and waiting area. So that's where maybe a personalized earbuds and people can listen to their own selection of music. But of course, the standards like classical music may transfer to a larger percentage of the population. But I think if you're going to different countries, what works in one country for art may not necessarily work for another country. So I think each clinic needs to probably individualize and personalize their waiting areas for the type of patient population and maybe even get feedback from patients to see, say, what type of paintings would you like to see? What type of music would you like to see? And getting some feedback so that patients have a vested interest in that clinic.
Yeah, I think there may go a little bit more thought into it. As Zia said, if there's a percentage of clientele that we understand that, one of the clinics I worked in New York City, the 80% population was old Spanish speaking,
Hmm.
20% was native. But then you can, in that case, maybe choose more towards, Spanish songs and the core, I think, or the baseline that goes towards it is not always the music itself, but or the core of the music itself. It kind of focuses towards that, where the tempo of the music still falls in place, the volume of the music falls in place, and those elements kind of strike a common tone in our brain because they are the ones that are calming the brain centers and it kind of initiating that parasympathetic response while they're there. And that, I think, tends to strike a common chord across cultures.
We're talking to Zia Altug and Shirish Sachdeva. Both of them are physical therapists. Their Kevin MD article is Why Your Clinic Waiting Room May Affect Patient Outcomes. Now, I'm going to ask each of you just to share some take-home messages that you want to leave with the Kevin MD audience. Zia, why don't we start with you?
My take-home message is that patient care begins in the waiting room. And if we can put a little bit more effort and time into that space, I think the patient outcomes and patient satisfaction scores will improve.
And Suresh, we'll end with you. Your take-home messages.
To tag on to that, I mean, environment is a silent clinician, right? And we don't need expensive renovations, right? I would say intention kind of beats the budget here. So we can lower the blood pressure, reduce fear, improve engagement, with nothing more than thoughtful designs, human-centered choices. And overall, I think if we want better outcomes, better compliance, and better trust with the clinicians, we got to treat the environment with the same care like we treat our clinical protocols. So healing does begin long before the first exam, as Zia said.
Both of you, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Thank you.
Thank you, Kevin, for having us. Appreciate it.